Many women are reluctant to have regular mammograms and colonoscopies for fear of what might be found. However, early detection is critical in making breast cancer and colon cancer treatable conditions. Both the Breast Center and Colon Wellness Center at the St. Barnabas Ambulatory Care Center offer patients expertise and the most state-of-the-art technology and diagnostic services available. We encourage you to schedule regular mammograms. It is a proven fact that regular screening and early detection can significantly reduce the risk of cancer.
This year in America, over 40,000 women will die of breast cancer. Another 28,000 women will die of colon cancer. It's the second leading cause of cancer deaths in the U.S.
So you're going to just feel some pressure now.
The best way to reduce these numbers and those of other life-threatening diseases is through early diagnosis. And the St. Barnabas healthcare system is a major resource for early prevention.
I started getting mammograms when I was 40 because I read many places that that was the thing to do, to keep yourself in good shape, that was the age, and so I began then.
For Susan Polizia, getting a colonoscopy was more than just routine.
I told the doctor about my grandmother had polyps removed and colon cancer. My mother had polyps removed. So he felt that I shouldn't wait until I was 50 to get one, that I should go now. But otherwise I had no symptoms.
As it turned out, these tests saved both of their lives.
In 2001, I came to the breast center for a routine mammogram. I had been here the year before.
Now you slide over to your left a bit. Okay.
And when I was done with the 2 films on each side, the technician came back and said, you know, she wanted to do another one, and then another one, and another one, and I started to get really nervous.
Dr. Linda Sanders is the medical director of the Breast Center at the St. Barnabas Ambulatory Care Center. She personally looked at Valerie's films.
Her mammogram came across my view box, and there was something abnormal.
I'm just going to scan your breast.
And an ultrasound revealed a small tumor.
She was very reassuring, and she knew what a nervous wreck I was. And, you know, she said there was something, but that I shouldn't worry.
A biopsy showed that the tumor was malignant.
Are you okay?
So Valerie ended up having surgery and radiation. And she's still taking follow-up medications as a precaution. But because the cancer was caught early, she survived. Susan first came to the St. Barnabas Ambulatory Care Center when she was just 44.
I was a little nervous, which is normal, but I wasn't really frightened because I had nothing wrong at the time, the first time I went. It was just to check.
Dr. Deborah Tarantino did the procedure.
And in that room will be myself, and there'll be a nurse there who's a registered RN, and there will also be a tech there, as well as an anesthesiologist.
She explained the procedure in detail, exactly what she would do, and she was very down to earth. You know, answered all my questions, and I just liked her. I was aware during the whole thing. They did give me an injection of something that made me feel very relaxed, but at the actual procedure itself, you don't feel a thing. No pain. I watched the whole thing on the TV screen. When she found the polyp, I actually watched her remove it and everything.
3 days later, Susan found out the polyp was malignant. And a month later, she had laparoscopic surgery to have that section of her colon removed.
Since she had it early, she's the earliest possible stage she can be and has an upwards of 98% survival.
Astonishingly, many women still don't get tested for either colon or breast cancer. Some from lack of knowledge, and some out of fear.
There are certainly women who are afraid, just afraid of analyzing the lump that they've felt in their breast, and we certainly see that.
And then I still think there's a good percent of the population that is ignorant as to how colon cancer progresses, how we can prevent it. And oftentimes they'll come in and say, well, I don't have any symptoms. I go to the bathroom regularly. I don't bleed. And why should I have a colonoscopy? Everything's great.
And then there's the fear of the procedure itself.
The procedure takes about 10 minutes to half an hour. to do the procedure, and that includes if patients have polyps and need to have polyps removed at the time. So it's a fairly quick procedure.
It's now been 4 years since Susan had her surgery. She's had several follow-up colonoscopies, and everything has been fine.
I can't even express how grateful I am. The messages have it done.
Valerie has been back to the breast center 3 times since her surgery.
I know that I'm in good hands, and I always make sure that Dr. Sanders comes out and says everything's okay before I go home, because I know I won't sleep that night, but so far so good. I think Dr. Sanders saved my life.
For more information about services offered at the St. Barnabas Ambulatory Care Center, or to schedule an appointment, please call 973-322-7000 or visit www.stbarnabas.com.